And also, a pregnant woman will also have a lot of dizziness, and this is mainly because of the postural hypotension. And women also undergo temperamental changes, and this is due to the hormonal fluctuation. Next. So, for the musculoskeletal system, due to the expansion of the uterus, it will lead to a progressive lumbar lordosis. And this is like in the picture, kind of like a curvature in the lumbar, and this causes more pressure on the lumbar, causing the low back pain. Also, because of the pregnancy, the pregnant state, there will be the stretch of the abdominal wall, causing stretch marks, like in the picture, and it's known as the stria gravidarum. Next. So, in order to increase the motility to ease birth passage, the body will increase the production of the relaxing hormone by the placenta, and the hormone will relax and widen the pelvic ligaments and the pubic symphysis, causing the relaxation of those ligaments and the symphysis, causing the easing of the birth passage. Also, during the pregnancy, there will be an increase in the melanocyte stimulating hormone, and this causes all kinds of pigmentation. And this one specifically, like in the picture, is the chloasma gravidarum, and this is when there's a butterfly pigmentation of the face. And for the GIT system, during pregnancy, there will be enlargement of the uterus, like in the picture. Because of the enlargement, the stomach and the intestine will displace upwards. This will increase in the intragastric pressure, which will then lead to gastrointestinal reflux. And the reflux will cause the nauseous and the vomiting. And during pregnancy, there will also be an increase in progesterone level. And due to the high level of progesterone, there will be an increased gastrin production by the placenta as well. And this will increases the gastric acidity, causing the heartburn. And also, again, due to the high progesterone level, there will be a reduction in the motility of the gut, which will then delay the gastric emptying time, which causes the constipation.
Time's up.
Okay, assalamu alaikum. Here we'll discuss the second two systems that show significant and severe changes during pregnancy, which is respiratory and cardiovascular system. Okay, next. So first, the body responds to the increased demand of fetus circulation to increase the blood supply to the fetus, mainly by the increased cardiac output, and there is decrease in systemic vascular resistance, increased cardiac output through increased heart rate and stroke volume, and decreased systemic vascular resistance. This is due to vasodilatation, will lead to decreased blood pressure, and also due to decreased blood viscosity, as we'll discuss later. Okay, next. The heart adapts to the increased cardiac demand that occurred during pregnancy in many ways, whereas the cardiac output increased through early pregnancy and the peak in the third trimester by increasing the preload and stroke volume, mainly by higher overall blood volumes, usually 30 to 50% above the baseline. Also, the heart ratio increases, but not above the 100 beats per minute. The total vascular resistance decreased by 20%, secondary to the vasodilatation effect of the progesterone hormone. Overall, the diastolic and systolic blood pressure dropped to 10 to 50 in the first trimester and then returned to the baseline in the second half trimester. Okay. The second system is the respiratory. The respiratory adapt and meet demand of the mother and the fetus through many changes in the all lung volume and capacity, and some changes in the upper airway respiratory tract, and also in the breathing pattern. Okay, next. Some of the blood volume and capacity increases and the other will decreases due to many factors. Increases due to meet the blood increased heart rate and stroke volume, and decreases due to there is increase in intra-abdominal pressure, which will result in elevation of the diaphragm. Elevation of diaphragm will decreases the functional residual volume. We can compare this blue circle. and also decreases the residual volume and decrease expiratory reserve volume. We also show some increases in respiratory capacity and increase in the tidal volume, and also small or a little effect on the respiratory rate by 1 or 2 breaths more than normal. And that's all for the respiratory system.
Good.
Wow. How long the time?
Okay, Rawan, she left 18-second balance.
All right. Thank you.
Assalamualaikum. So I'll be explaining about the urinary and hematologic system. Next. So mainly in renal system, the changes are mainly mediated by progesterone. Progesterone, it will act on the afferent arteriole in kidney, which will cause vasodilation of the afferent arteriole, and it will cause the increased blood flow to the glomerulus, and this will increase the glomerular filtration rate. So increased glomerular filtration rate will do some things in our body. The first one is increase in urine production, which will cause increase in urination. And number two, the high volume of urine within the nephron and ureter will cause increase in hydrostatic pressure. And this will lead to hydronephrosis and hydroureter, which basically means increase in size of the ureter and kidney. And the last one is ureter dilates due to the smooth muscle relaxing effect of progesterone. Next. And the next system is hematology system. The first effect that will change is high 40 to 50% of increase in plasma volume and 20 to 30% of increase in RBC production. So increase in plasma volume will cause peripheral edema, which is a normal clinical feature of pregnant ladies. And so the ratio of plasma volume and RBC production is not equal, it's different, significantly different. So this will cause anemia too. And this is the main reason of anemia in pregnant ladies due to decreased rate of RBC production related when compared to the volume of plasma volume. And the third thing is increase in hypercoagulability. Pregnancy is a really hypercoagulable state. And this due to increase in procoagulation factors, increase in platelet aggregation, and increase in potential stasis of blood. So in pregnancy ladies, deep vein thrombosis is normal. Next. I've already explained this one. So women are at highest risk of developing clots, thrombi during the weeks following labor. That's all. Thank you.
Okay, next slide. So I'll be explaining about the changes in the endocrine system during pregnancy. Next slide. Okay, first in the progesterone, we have to know that it is initially being produced by the corpusculum around until 10 weeks, and then the placenta will take over 8. So basically, the progesterone will be produced in a really, really high amount, and then it will gradually decrease in the last months of the pregnancy. Like we have to know the function of the progesterone is to maintain the pregnancy, raise the uterine threshold to contractile stimuli during pregnancy, and participate in the breast development as well. And then for the estrogen, it is the same as the progesterone, as what I told before, that it is being initially being produced by the corpusculum, and then the placenta will take over it, where it will reach the peak of the production at the date of the birth. And then the function is supposedly it can increase the blood flow to the uteroplacental, or we call it as a uterine contraction process sector. And then it is also important for the development of the mammary gland. And also I forgot to mention that in this slide, where the placenta is the one that responsible in producing the HCG as well, that the HCG can promote the progesterone that can help with the production, can help with the development of the fetus. as well. And then mainly of almost all pituitary hormone found to be increased in pregnancy. That basically it can increase the growth hormone, increase the prolactin, which is due to the estrogen, increase in TSH that lead to thyroid gland hyperplasia, low gonadotropin due to estrogen, and then ADH and oxytocin steadily increase in pregnancy. Next slide. Okay, firstly, in thyroid gland, the high estrogen level will cause increase in thyroid binding globulin. So more free T3 and T4 will bind with this thing, and then eventually it will increase TSH. So when there's like increase in TSH, it will stimulate more T3 and T4 by the anterior pituitary gland. So basically, this hormone is important. Thyroxine is important for the fetus neural development. And then we have the adrenal gland that supposedly the placental CRH will stimulate the cortisol secretion. So the cortisol is important for the fetal development or motor maturation process. And then for the pancreas, it will associate with the insulinemia and insulin resistant, where it will accelerate the fasting hypoglycemia that will lead to prolonged hypoglycemia. That supposedly this process is to supply more glucose for the fetus for the maturation process as well. Next slide. That's all from me.
Okay, so now I'll be presenting on the reproductive system and the changes that we can see during pregnancy. So firstly, we'll go through the genital changes. The first one is vulva, which will appear edematous and become more vascular. The labia minora will also become pigmented and hypertrophied. And then we go to the genital tract, starting with the fallopian tube. So the muscles lining the tube will become hypertrophied as well, and the tube will also increase in length. Next, we go to the uterus, which the uterine muscles will undergo hypertrophy and hyperplasia, which results in increase in weight and size. And so the uterus will expand from being a strictly pelvic organ to become abdominal organ due to the uterine muscles, the growing fetus, increase in elastic tissue, and increase in angiogenesis. The uterus will also change in from being pear-shaped organ to an ovoid shape. It will also undergo dextrotation, which is basically tilting and twisting of the uterus so that it's slightly to the right. And some women will experience Braxton Hicks contraction, which is also called as false labor pain, because it produces the same contraction, but it has no effect on the dilatation of the cervix, and it is also not painful. Then we go to the cervix, which will become bulky, congested, and soft. There's also an increase in secretion of the mucus due to an increase in the activity of the mucus glands. And soon enough, this secretion will become stickier and thicker, so it forms the mucus plug or operculum, which closes the cervical canal, acting as a barrier between the cervix and the vagina in order to prevent infection and also to prevent leakage of the uterine fluid. Then with the epithelial lining, the vagina also becomes thicker, and it also appears bluer due to increase in vascularity. Women will also experience leukorrhea, which means there's an increase in the vaginal secretion, which will become acidic. Then we go to the breast changes. So the breast will increase in size due to two things. One is due to deposition of fat around the glandular tissue. The other is due to distension of the alveoli by milk, which is stored in the reservoir. And the breast will also become warm, tense, and tender to touch due to an increase in vascularity. There's also marked hypertrophy and proliferation of the glandular ducts. Next, we go to the areola, which will become darkened due to an increased level of estrogen and progesterone. There's also appearance of Montgomery's tubercles, which is basically Montgomery's gland, which become hypertrophied. And the nipples also become larger, erectile, and pigmented. So that's all for our presentation.
Okay, thank you, Group 1, and thank you for Sifa. I'll be back to you later, and anybody, if you have question, also keep it for later, okay? So second group, you can choose or I choose?
You choose.
Second group, can we present? Okay, we take Akil, okay? Because he attended first with Otto, so I think it's fair enough, okay? We go with Akil group, then Matira group, okay? Okay, Matira.
Yes, okay.
All right, so the one who justified the time, I would ask Ainan, okay? So everybody mute except Ainan and the presenter. Okay. Can you share, Akil?
Cannot.
Ainan, is it okay for you? Or you want me to? Okay. So same.
It's 3 minutes, right?
3 minutes. Okay, then the overall 3 minutes. All right, thank you.
I will start the presentation.
Akil, can you tell me who will be present first, second, and so on? Akil.
Wait, okay. So, Assalamualaikum warahmatullahi
No,
wabarakatuh.
before we start the presentation, I want to know who's going to present first, second, and so on.
The first presenter will be Nakib. The second,
Okay, wait. I want to write. Okay, then
the second presenter will be Akil Azrai.
okay, wait. All right.
Then Otoraya. The fourth one.
The third. Okay.
The fourth one will be Zul.
Okay.
The last one will be me.
Okay. Okay, you may start now. So we start with Nakib, okay?
Okay.
So Ainan, you can start once Nakib starts speaking.
Okay.
Assalamualaikum and very good afternoon everyone. So today I will present about changes in reproduction system. So the first part is vagina. So vagina will become hypertrophy, adamant and more vascular. So there will increase blood supply of venous vessels surrounding of the wall of vagina. The length of vagina of anterior vaginal wall is also increased. The space of vagina become appears thin and curvy one. Vagina will become more acidic between 3.5 until 6%. So second part is uterus. Uterus will increase in growth and enlargement of body. So there is changes in the muscle. First one is hypertrophy and hyperplasia. They will occur under the influence of hormone, estrogen and progesterone. So second part changes in the muscle is stretching. The muscle fiber further elongate between 2 centimeters due to the distension by the growing fetus, and the wall become thinner and the pressure about 1.5%. So next is vascular system. So uterine artery diameter become double. As you can see from the slide, so the blood flow will increase by 8-fold at 20 weeks of the pregnancy. Then also vasodilation is mainly due to the estrogen and progesterone. So will become more dilated and bulbous. So there is numerous lymphatic channels open up, and lastly vascular changes are most pronounced at the placenta side. So the weight about this will be increased by through of uterine muscle and connective tissue and vascular channel. So shape also will be changed during at the early month. There will be maintain the shape like non-pregnant form. So at 30 to 20 it becomes globular, and after 28 weeks, it becomes periform or oval. It's more periform or oval. So at 36 weeks, it will become the shape spherical. So next slide about but as you can see the from slide, the first during the first trimester illness, and it elongate to about 3 times from its original length. It must become more softer. So next slide about cervix. So cervix hypertrophy and hypertrophy of the elastic and connective tissue. There will also vascularity is increased. There is some softening of the cervix which are golden side. The squamous cell also become hyperactive. The mucosa changes stimulate the cell hyperplasia or cervical intraplasia neoplasia. There will also secretion is So please, Anthony, physiology.
Sorry, I'm so
neuro
done.
for your
That's 3 minutes.
Okay.
Next presenter.
So I will present the change in the maternal endocrine system, which is okay. Right. So for the firstly, as we can see, there are 3 trimester. Is the first trimester is a placenta and the flattened circular vascular organ that connect to the developed fetus. And then the second trimester is a uterus, continues the fetus group, and then the third and the final is it lasts for the birth, typically at the 14 weeks. So we use the hormone and in the human gonadotropin is an important hormone that's for early pregnancy, which is produced for the implantation and support for the function of the corpus luteum. And then the corpus is a temporary structure in ovaries which produce the other keys in the hormone during the early pregnancy. And also we use for the and then the important hormone is progesterone. At the beginning is the produced by the corpus luteum, and then it's maximus into the 10 weeks, then decline gradually to placenta, and then to produce progesterone until they reach maximum. And then it's to prevent the premature uterine contractions, reduce the tone of muscle that's causing the constipation with the retention in the colon, and then decrease the tone of the uterine and uterine muscle, and then participate for development of the mammary gland and increase the storage of fat due to catabolism. Okay, and then also estrogen also same like progesterone produced at the corpus luteum, and then takes over by the placenta, and then to produce estrogen, and then reach into the peak of the date of birth. And then estrogen has a vasodilation effect, which is increased for the blood flow to uterine placenta and prepare for the uterine contraction. And then it also have a catabolic effect and its role for the development of the mammary gland, estrogen, and increase the water retention. And post, okay, and then other hormone is prolactin. So the prolactin is the main hormone to need to trigger for the breast milk production, and then it's contribute also for the development of the fetal lung, brain, and also mother immune system directing to the fetus.
So, Bismillahirrahmanirrahim. Assalamualaikum and very good afternoon to Dr. Fatima and all my classmates. So I'm gonna talk about the changes in maternal cardiovascular and respiratory system. Next. So in the cardiovascular, as we know that the placenta is developed in the uterus, so that's why the increase in uterus birth flow. That's why during this in the pregnant woman, the maternal cardiac output will slightly increase between 30 until 40% above the normal, but peak at the third trimester. This is also due to the mother metabolism. Secondly, the blood volume increase. This is two effect for hormone effect, mostly due to aldosterone and estrogen due to the causes increase in fluid retention. Also, these two aldosterone and estrogen cause the bone marrow to be more active and produce red blood cell more to provide the development of uterus. And then for the blood pressure is slightly decreased because of the effect of progesterone, because it has the vasodilatory effect on the total systemic vascular. This can cause systolic and diastolic drops between 10 to until 50 milliliter per mercury in first trimester, but slightly it will be back increased slightly. Next slide. So for the respiratory system, actually in mother, in pregnant woman, mostly they will experience the increase in respiratory rate to maintain their extra ventilation. This is due to increase in basal metabolic rate, such as weight and size, due to increase in use of amount and carbon dioxide produced increased by 20% above normal. Also, the effect of the progesterone increase the sensitivity of respiratory center to carbon dioxide. Also, due to the uterus growing, this uterus growing will press against diaphragm and lead to the accretion of diaphragm and lead to the extra ventilation will suppress our thoracic cavity. That's why pregnant women will have the gasping for air if they do more huge activity, heavy activity. That's all from me. Thank you.
Okay, Assalamualaikum. So now I'll present about the changes in GIT adrenal system during pregnancy. So next slide. So what happened for the physiological changes? So that the progesterone will causes the smooth muscle relaxation, which slows down the GI motility, and also decreases the lower esophageal sphincter (LES) tone, and then that will lead to the result increase in the intragastric pressure combined with the lower LES tone, which will lead to the gastroesophageal reflux commonly experienced during pregnancy. And then also the woman who experience pregnancy will cause nausea and vomiting of pregnancy, which is known as the morning sickness, which is the most common GI symptoms of pregnancy. It usually begins between the 4 until 8 weeks of pregnancy, and usually subsides by the 14 to 16 weeks. And then the exact cause of the nausea is not fully understood, but it usually correlates with the rise of the levels of the human chorionic gonadotropin, progesterone, and the resulting relaxation of the smooth muscle of the stomach. Also, the constipation and hemorrhage can also occur at the GIT during the pregnancy. Okay, next slide. Okay, so this is the example for the signs and symptoms that happen to women when they're pregnant. So, such as the vasodilation of the blood vessels, the presence of the CG, constipation, frequency of micturition, headaches, fatigue, breast tenderness, and also the primary hormones. Okay, next slide. Okay, so the physiological changes in the renal system is the pregnant woman may experience an increase in the size of the kidneys and also the ureter due to the increased blood volume and the vasculature happen there. And then later in the pregnancy, the woman might develop physiological hydronephrosis and hydroureteronephrosis, which is considered normal in the pregnancy. And then there are increase in the glomerular filtration rate associated with an increase in the creatinine clearance, protein, albumin excretion, and also the urinary glucose excretion. There is also increase in sodium retention from the renal tube, so that the edema and water retention is the common sign for the pregnant woman. And then when the third trimester happened, the fetus started to engage in the pelvis. And there is also the bigger chance in increasing the frequency of urination, which is more incontinence happen in the urination. Okay, next slide. Okay, so this is the physiological changes in the kidney, as we know that such as the RAS activity is increasing because the renal function, and then as the structural changes, the hydronephrosis.
Time's up already.
Okay, that's all for my part. Thank you.
Okay, next will be me presenting changes in musculoskeletal system. Okay, first one is postural changes. Okay, the overall equilibrium of the spine and pelvis alters as the pregnancy progresses. The exact cause is actually unknown, but weight gain, increased blood volume, and ventricular growth of the fetus are suspected to be a cause. This will cause the center of gravity will no longer fall over the hip. And then there is also an increase in the anterior, posterior, and medial lateral sway. The mother may need to lean backwards to get equilibrium, resulting in disorganization of the spinal curves. The reported postures include a reduction in lumbar lordosis, an increase in both lumbar lordosis and also thoracic kyphosis, or a flattening of the thoracolumbar spinal curve. Compensatory changes to posture in the thoracic and cervical spines, and also the extra weight of the breast may result in posterior displacement of the shoulders and thoracic spine, increase anterior pelvic tilting, and also increase the cervical lordosis. These changes may still be similar for 8 weeks after delivery. So here we can see there is like the gradual postural changes that occurs in pregnancy. Okay. So next one is articular changes. Okay. There is a change in collagen metabolism due to altered levels of relaxin, estrogen, and progesterone during pregnancy. This will cause the breakdown of collagen in the targeted tissue and replaced by a modified form that contains higher water content. The increase in connective tissue pliability and extensibility. Therefore, the ligamentous tissues are predisposed to laxity. Okay, what is laxity? Laxity is when the ligament becomes loose. Okay, with resultant reduced passive joint stability. Ligament laxity reaches its maximum at the second trimester. The cubic symphysis and sacroiliac joints are particularly affected to allow for the birth of baby. And then the biomechanical changes of the spinal and pelvic joints may involve an increase in sacral promontory, an increase in lumbosacral angle, a forward rotatory movement of the innominate bones, and also downward and forward rotation of the symphysis pubis. Okay, the pubic symphysis gap of 4 to 5 millimeter shows an average increase in 3 millimeter during pregnancy. Pelvic joint loosening begins around 10 weeks with maximum loosening near term. Joints should return to normal at 4 to 12 weeks postpartum. The sacrococcygeal joints loosen, and then the last trimester, hip adductor, extensor, and ankle plantar flexors increase their net power during gait, and there is an increase in the load of hip joints 2.8 times the normal value when standing and working in front of worktop. As the uterus rises in the abdomen, the ribcage is forced laterally and the diameter of the chest may increase by 10 to 15 centimeters. Okay, this is the diagram. And then the last one is neuromuscular changes. There will be decrease in muscle stiffness and also active stability of joints may result from alteration of muscle spindle regulation, and this is applicable particularly to muscles around the pelvic girdle. These changes may cause pelvic girdle pain. That's all. Thank you.
Okay, thank you. Group 4. So maybe we proceed with group 3. Material group. And who wants to justify the time? Oyun, are you there?
I will do it, Doctor.
Okay, so Oyun, are you eating?
Hazila, Dr. Hazila.
Hazila want to do. Okay, so Hazila will justify for group 2. Okay, thank you. So group 3 material, may I know the sequence while you are sharing the presentation? So means you share and tell me who will present first and so on. Matira?
So the first one, I will be, first is me, Matira. Second Kai, but he said he cannot attend today. And third one, Onef. Fourth, Aisha. And last, Anis. Okay.
Okay, wait.
Start now.
Aisha, then the last one, Anis.
Anis, yes.
Anis, okay. So you made some, and then you just Kai part, or I don't know if anybody wants to replace Kai's one, it's up to you. Okay, so Kai's slides, so you can skip.
Okay, Doctor. Start now. Whenever you're ready, Matira.
I think Doctor is still talking, but like
Huh? Wait,
Doctor, we cannot hear you.
For example,
Okay.
Doctor.
Doctor, we only hear example.
Yes.
Yes.
okay, hear you.
Okay.
You just present.
Okay.
Okay. Okay, so firstly, I will be explaining about the endocrine system. I will be presenting about the placenta, which is the major, next, the major endocrine organ of the pregnancy. It mainly secrete many hormones, but I will explain three hormones only, the HCG, estrogen, and progesterone. So firstly, I will talk about where the hormone come from. So during the during implantation, there are two parts of the blastocyst. The inner cell mass that become the fetus, and the outer layer called trophoblast that develop into fetal part of the placenta. Those trophoblast cells that produce hormone called human chorionic gonadotropin (HCG). So why this hormone is important? Firstly, it is to maintain the corpus luteum of pregnancy. HCG, like the corpus luteum, knows that there has been successful implantation to the endometrium and that it should continue to make estrogen and progesterone. Because of the persistent estrogen and progesterone, the thick endometrial tissue is maintained and accordingly no menstruation during pregnancy. And the high level of progesterone will inhibit the LH, luteinizing hormone, which hormone that maintain the corpus luteum during the normal luteal phase of the uterine cycle. Also, in a male fetus, HCG also stimulate the precursor Leydig cells in the fetal testis to secrete testosterone, which masculinize the developing reproductive tract. So this HCG is the hormone that most pregnancy are able to detect as early as the first month of pregnancy, about 2 weeks after the first missed menstrual period, as this hormone is eliminated from the body in the urine. Okay, next. Pregnancy is about 9 months in duration, and we are looking at the three hormone relative blood vessel on the y-axis. Okay, y-axis. So during first trimester, which is week 1 until 12, estrogen and progesterone are being generated by the corpus luteum. And the secretion rate of the HCG increase rapidly during the early pregnancy to save the corpus luteum from shrunken. The peak secretion of HCG occur about 60 days after the end of the last menstrual period. By the 10th week of pregnancy, HCG output decline to a low rate of secretion that is maintained for the duration of gestation. The fall in HCG occur at a time when the corpus luteum is no longer needed, and luckily the placenta take over to secrete the estrogen and progesterone. Okay, next. So the role of estrogen and progesterone during pregnancy is the estrogen stimulate the growth of the myometrium, increasing the uterine strength for parturition, and help prepare the mammary gland for lactation, and progesterone suppress the uterine contraction to provide quiet environment for the fetus, mainly to prevent miscarriage. Next is to promote promote formation of a cervical mucus plug to prevent uterine contamination and help prepare the mammary glands for lactation.
Thumbs up.
Okay. Now.
Next, please. Next. So now I'll talk about the respiratory system. So there's an extra human being inside the mom's belly, right? So there's also an increase in oxygen need. Therefore, there are more oxygen intake by our body for about 20% increase. And how does this happen is because there's also an increase in minute ventilation, which is the volume of air taken each minute. Aside from what Matira said about the role of progesterone in blood also helps signal the respiratory center in brain to instruct lungs to take in more air with each breath. Therefore, the increase in minute ventilation, and because there's more oxygen, there will also be more carbon dioxide expelled to our body, right? To counter this, we will increase the bicarbonate secretion from the kidney, and this will cause our blood pH to become normal or slightly basic, that is alkalosis. Next. So for reference renders, I'm going to take your attention to the bicarbonate because I said before it increased in pregnant, increase secreted in pregnant women, but here it is low because when there's also while an increase, there also an increased usage. That's why it is lower than non-pregnant. And because the baby size is increase in uterus size. Next slide, please. There will be an diaphragmatic elevation, which causes the lower functional residual capacity. But because there is also diaphragmatic excursion increase, the vital capacity is remain unchanged. And for the changes with times, Aisha, next slide, please. So in early pregnancy, because our body is still trying to adapt, there will be increased tidal volume, the air intake, and there will be reduced inspiratory reserve volume. But by time third trimester, because our body is already adapt, there will be a reduced functional residual capacity. That is the amount of air left in lung after taking breath, and there's increase in inspiratory reserve volume as compared to the early pregnancy. So that is all for the respiratory system.
Okay.
Okay, for the renal system, we know this is the structure of the renal system in the kidney. So we have apparent arterial, glomerulus. So I just give this slides to review the past that we learned. And then first, we know that during pregnancy there is progesterone. First, we be secreted from corpus luteum, and second will be through continue by the placenta. So increase in progesterone will make the vasodilation. It's actually a generalized vasodilation. So in the renal, it will vasodilate the afferent arteriole. So what happens if the afferent arteriole will vasodilate? So it will increase renal blood flow. So more and more blood will coming to the afferent arteriole. So when the afferent arteriole is so when the glomerulus is receive more blood, so it will increase GFR, which is glomerulus filtration rate. So during this phase, it will increase the urination. Increased urination will make the increased excretion of the glucose, albumin, and protein. So that's why sometimes in this gestational phase, there will be you commonly hear about the gestational diabetes. So usually it comes during pregnancy, but then it will disappear like that after the delivery. So uniquely, our kidney have an adaptation to the increase in blood flow. So it will because we want to use more and more we want to process more and more blood, so it will increase the size of ureter and kidney, so that more and more blood will be processed into the urine. Okay, so basically people women that have urinate, they will it's so difficult to because they always like want to pee. So when during they need to pee a lot. So what can be avoided to make the peeing better? The symptoms better. Okay, first is avoid taking drink that have mild diuretic effect like coffee and tea. This is actually a normal advice to the pregnant woman. So if the pregnant woman always drink mild diuretic effect, it will constantly make the pregnant woman want to pee more. And then during the pregnant woman need to lean forward so that it can helps to empty the bladder completely. So the process of peeing it will be completely smooth. And then don't go thirsty. So pregnant women always tends to thirsty themselves because they want to avoid often pee. So it's actually dangerous. We must stay hydrated because it is important during the pregnancy. Okay, so always check the pee color. Okay, thank you. That's all.
Okay.
Okay, next, I'm Anis. So I will present the physiological changes that will occur in the gastrointestinal system. Next slide. I will explain more on the relations of the GIT system changes to the common symptoms that occur in pregnant mothers. The first changes is the heartburn or reflux. The main reason for this situation is progesterone. Progesterone causes smooth muscle relaxation, which have two effects, which is the first one is to slow down the GI motility and to decrease the lower esophageal sphincter tone. The resulting increase in intragastric pressure combined with the lower esophageal sphincter tone leads to the gastroesophageal reflux, which is commonly experienced during pregnancy. That's because hormone cause the digestive system to slow down, and the muscle that push food down the esophagus also move more slowly in pregnancy. And as the uterus grows, it push on the stomach. This can sometimes force stomach acid up into the esophagus. This is why the reflux occurs. But anyway, no worries, because it's rarely cause complications to the pregnant mothers. Okay, next slide. The second point is the most commonest one we had in pregnancy mothers, which is nausea and vomiting. It's too often to the point where if someone have this symptom, people will just ask them to do pregnancy test. That's how common it is. Okay, so it is also called as morning sickness. It begins 4 to 8 weeks, subside by 14 to 16 weeks, about 3 to 4 months. Exact causes is unknown, but it may associated with gonadotropin, progesterone, and the resulting relaxation of smooth muscle of stomach. Also, constipation and hemorrhoids can occur during pregnancy, which is the third point of the physiological changes in GIT. Next slide. This is one, constipation and hemorrhoids. It is due to the same reason, which is progesterone. So what actually makes the progesterone effects induce constipation? This is due to the effect, which is pressure by the baby inside the uterus. It will inhibit the gastrocolic reflux. Both of these effect will reduce bowel motility and leads to constipation, which is loose urge to defecate. Hemorrhoid, which will occur at the end as when the pregnant mothers experience constipation for a long time. Okay, in constipation, when stool is hard, there will be extra training we need to eliminate it right. So this situation will put pressure on the veins in the mother rectal area and cause them to swell and bulge. That's all from me. Thank you.
Matira, can you show the presentation? Just go through the slides from first to last slide. Just go through the slides. Okay, thank you. So the last group will be group 2, isn't it? Group 2. And thank you,
I'm trying to.
Thank you for the timing. Yeah. And okay, who wants to fix the time for this? Or I choose.
Me, Otto. Otto.
Okay, thank you, Otto. Okay.
Cantik gila.
So who will present first?
Okay, so the first presenter is me, Uyun.
Me, Uyun. Okay. Then
after that will be Hazila.
Okay.
And then Siva, Yani,
Siva,
and last will be
Yani.
Shahira.
Okay, Shahira. All right.
Okay.
So you present until we reach Shahira. Then when we reach Shahira, she can give it a try. If we cannot hear her, maybe later I give her a special time with Zoom. Okay. So you may start now, and also you start with the time once you start speaking. All right. Thank you.
Okay, doctor.
Okay. Can I present first?
Yes, start please.
So I will present. Our group will present about physiological changes during pregnancy, and I will present how.
Sorry, Oyun. Everybody, please mute your sound. Hazila, mute now. When you present, you can. Okay, so it will be more clear. Thank you.
Okay. So I will present about the endocrine system. Okay, so first of all, we all know that placenta plays a huge role in pregnancy. So placenta also secretes hormone because it is a temporary endocrine organ in pregnancy. So there are many hormones that placenta secreted, but these are the three that I'm going to present. So the first one is human chorionic gonadotropin, which we also call HCG. It maintains the function is that it maintains corpus luteum during pregnancy. It also stimulates secretion of testosterone by the developing testes in the SY embryos. Next, we have estrogen and progesterone. Estrogen and progesterone actually first secreted by the corpus luteum, and after the first trimester, it will be secreted by placenta itself. Okay, so the first function of estrogen is to stimulate growth of myometrium. Also, it increases the uterine strength for the labor. It also increases the duct development to prepare the mother for the breastfeeding. And for progesterone actually the main function is to avoid miscarriage. So it will suppress the uterine contraction. It will also increase the milk gland development for the breastfeeding. Okay, now we look at the hormones concentration during pregnancy. So as you can see here, the secretion rate of HCG increases rapidly during the first trimester to save the corpus luteum because we need the estrogen and progesterone, right? And peak usually occur before 3 months of pregnancy. After that, the HCG secretion will decline because the corpus luteum is no longer needed for estrogen and progesterone. So as for estrogen and progesterone, it will increase steadily throughout the pregnancy, but before it will drop and allow for the labor. Okay. So for other changes in the endocrine organ, in the pituitary gland, there will be proliferation of lactotroph cell. Lactotroph cell is actually sensitive to estrogen, so obviously during pregnancy, the estrogen level will increase. So this will lead to increase in. For adrenal gland, there will be increase in placental corticotropin hormone, which placental corticotropin hormone usually for the baby, but sharing blood, right? So the mother will also increase the cortisol from the adrenal gland. So in the pancreas, there will be increased need for glucose, right? Of course, when pregnant. So insulin will also be increased, and as a result, there will be hypertrophy and hyperplasia of the beta pancreas itself. In the thyroid gland, there will be decrease in TSH, but only in the early trimester. But the T3 and T4 will be increased actually due to stimulation of HCG and estrogen. Also, there will be increase in parathyroid hormone because we need more calcium for the fetus. Okay, that's all from me.
Habis. Done. Oh.
Okay, so now I will explain about the changes in the reproductive system. So high level amount of progesterone and estrogen will cause growth of uterus. So both uterine suction rate and blood flow will increase 10 times more than the non-pregnancy state. So increased uterine artery flow will cause vasodilation of the uterine artery, and these vascular changes are most pronounced at the placenta. This to ensure that there is enough blood supply to support the uterus growth and the placenta for the baby. So for the increased uterus size and weight, for the first 12 weeks in pregnancy, this increase is due to the hypertrophy and hyperplasia of myometrium. But after that, the uterus size increase is due to the stretching of the myometrial fibers by the growing fetus. So why the hypertrophy and hyperplasia is important? Because that's like other than support for the baby, other than to support the baby growth, it also important in a mechanism called leaving ligature. So this mechanism is that you imagine it is straw and my hand is myometrial. So when your placenta is detached from the uterine wall, our uterine will contract, right? Will contract the blood vessel to prevent bleeding. So if there is not enough hypertrophy or hyperplasia of the myometrial, there is not enough contraction, and this will cause major blood loss during delivery. Next slide. Then we also have cervical changes such as interscarp that we add as protective barrier for the uterus from any infection. And there is also increased vascularity of the cervix that will show the Goodell sign and Chadwick sign. Next slide. Increase high estrogen will increase the position of glycogen at the vagina. This glycogen will reduce by the vaginal lactobacilli and they will metabolize it to lactic acid. It will increase the vaginal pH and create an acidic environment so that no pathogens can live and grow in the vagina. Next. And the breast changes is mainly for to prepare the breast for the lactation. So there is increased size of the breast due to the enlargement of the breast lobules and proliferation of the lactiferous duct system. And other than that, the areola also become more bigger, darker, and we call it secondary areola will also appear. Scientists don't know why the purpose of this. I also don't know, but they think it's because they want so the baby can find the areola easily, find the nipple easily during breastfeeding. That's why it become bigger. There is also hypertrophy of sebaceous gland. We call it Montgomery tubercles that will secrete substances that have antibacterial purpose and will lubricate the nipple. Next. For the renal system, okay, so a pregnant woman, they actually will complain about they always want to go to toilet. So why this happen? Because one of the reason is the increase in glomerular filtration rate. And another reason is because in the early pregnancy, the uterus will compress the bladder and increase the urinary frequency. Then in the mid pregnancy, they will often the urinary frequency back to normal.
Okay, good afternoon. I, Sivarani, will be proceeding with the next part, which is respiratory system. Next slide. Okay, so for my case, this one will be a pregnant lady which is in a second trimester. Okay, what will happen is because of the hormonal influence, progesterone and estrogen. Okay, whatever changes is actually for the maternal adaptation to increase the demand to grow the fetus. So the respiratory system will allow to delivering the oxygen required for the fetus and also removing the carbon dioxide, okay, the waste. Okay, so this hormone will do two things. One is enlargement of uterus and also acting on the respiratory center. For the enlargement of the uterus, right, this hormone will lead to increase in the intra-abdominal pressure. So when the intra-abdominal pressure is increased, it will lead to increase of the elevation of the diaphragm, which is up to 4 cm, and chest circumference increased by 5 cm. So in this case, it's automatically the alteration of the ventilation take place, and there is changes in the total lung capacity. So total lung capacity means is the maximum amount of air of the lung can be contained. So for this case, it will be decreased up to 5 cm. Okay, this will lead to diaphragmatic breathing, which means the maternal body will use the abdominal to have an efficient breathing rate. They will use the diaphragmatic breathing. So in the other side, you can see there is acting on the respiratory center. So for even though it's a two hormone, the mainly is affecting the respiratory center is the progesterone. So this hormone will act on the respiratory center. So it will increase the it's actually to the increase of the sensitivity to the carbon dioxide in the body, in the blood, and it will lead to the state of hyperventilation. So in the case of hyperventilation, it's automatically it will lead to the respiratory alkalosis due to the demand of the metabolic demand in the body for the growth. So I'm focusing on the peripheral chemoreceptor, whereby it will be action on the carotid and aortic arch, which will be the primary response is due to the changes in the hydrogen ion, and secondary to the changes in the carbon dioxide. Okay, it will actually lead to increase in the respiratory rate and also blowout of the carbon dioxide, and it will shift the equation to the left as the equation is below written to get rid of the hydrogen ion. Okay, because in this state is alkalosis is the increase in the pH. So the reduced amount of carbon dioxide will promote the reduction of hydrogen ion. So this is the balancing of the adaptation in the maternal body for the fetus growth. That's all my part.
5 second extra.
Sekejap.
Mulakan dengan bismillah.
Okay, Bismillahirrahmanirrahim. Assalamualaikum warahmatullahi wabarakatuh. I'll be proceeding regarding the hematological changes. Next slide. Okay, so for the hematology, basically, when before pregnant know that they are pregnant, body already undergo several changes, and the most important is there is a low oxygen. So when there is low oxygen, there will be high erythropoietin will be released in order to make sure that more red blood cell will be production. On the same time, there will be also activation of renin, angiotensin, aldosterone system, which can lead to more water retention, blood volume and plasma volume will be increased. The imbalance between increase of plasma volume and the increase of red blood cell is imbalance. It leads to the condition known as hemodilution, and this condition will also cause physiological anemia in pregnant women. Secondly, the changes of pregnant women also will have pathological anemia. It is a condition of iron deficiency due to two causes. The first one may be due to the menstruation cycle before the pregnancy occurs, and secondly due to the fetal iron demand. Other changes we can see is coagulation, where during pregnancy they are in a hypercoagulable state. Why it is hypercoagulable state? Meaning that blood can be easily clot due to the increase in factor 7, 8, 9, 10, and due to the increase in fibrinogen. Hypercoagulable state is a protective mechanism in order to avoid excessive bleeding during pregnancy, especially during the detachment of the placenta. And other changes that we can see also, there is also increase in neutrophil, and usually thrombocyte is unchanged. And lastly, in immune response, cell-mediated immunity is decreased, but humoral and innate immune response will increase. Why? Because we need passive immunity from mother, we transfer it to fetus through placenta. Okay, other changes is, next slide. For the gastrointestinal changes, we can see that high estrogen will cause 60% of pregnant women have developed palmar erythema, which is the reddish at the hand or the face because of estrogen. It causes vascular changes. High progesterone will also cause more gastrin to be released in the stomach, and it will cause increased acidity and low pH in the stomach. High progesterone will also cause lower esophageal sphincter tone to decrease, and it will lead to the esophageal reflux. And high progesterone will also cause reduced gut motility, and it will decrease emptying time, which can lead to progesterone. And estrogen also will effect on the gallbladder, and it will inhibit polycytokinin mediated smooth muscle constimulation, and it will cause mostly pregnant women have high cholesterol. And lastly, next slide. The changes during the integumentary system or MSK. So pregnancy will cause hyperstimulation of endopituitary as well as placenta to release melanocyte stimulating hormone MSH. So this MSH will increase, it will cause hyperpigmentation that can be seen at the stomach, face, areola and nipple. So at the stomach, there is a dark vertical line known as linea negra, and at the face, it was called glaucoma. At the nipple and areola, when there is hyperpigmentation, it's indicating that the woman is ready for lactation. Other changes that we can see is striatum gravidarum. This pinkish or reddish streak running down abdomen. Why it is happen? It is because of increased cortisol and estrogen, and it causes the rupture in collagen matrix of the dermis and weakening the elastic fiber. And lastly, the last changes is due to the progesterone and relaxin, it causes pelvic sympathic to relax, and it will shifting towards the center of gravity. It allows for the pregnant mother to become more steady during pregnancy. That's all from me. Thank you.
Okay, thank you also, and thank you for all of you. Is Shahira available? I saw her meeting.
Yeah, she lost connection, doctor.
Oh, okay. So,
Move to Zoom, doctor.
All right, since we don't have also Kai for today,
Yes.
so you want to proceed with Shahira, or we give Kai and Shahira another time?
We can ask Shahira.
Let Shahira decide, doctor.
Okay, so can you ask her now? We wait.
She want to present today, doctor.
Okay, all right. So wait now. Okay, so okay, so I already sent for you Zoom, so we can continue with the Zoom, okay? So if somebody cannot continue for now, it's okay, no problem, okay? All right, so we leave this one.
Cannot share Rata. You need to enable the screen share.
Okay. You try now. Okay. So, Otto, you can justify the time. 3 minutes for Shahira, okay? Once Shahira starts speaking. All right.
Okay. Bismillah, Assalamualaikum. Yeah, I'm Shahira. Now I'll be talking about the physiological changes in cardiovascular system during pregnancy. Why there is changes? So yeah, let's look the reason behind this. Don't sleep, everyone. Please look at the slide and focus on the highlighted word. Listen what I'm trying to say, okay? First, what happened to blood volume? Obviously, it will increase. Why? Everyone, please think logic. For sure, to provide nutrient to fetus or maybe oxygen, okay? Red blood cells are like the shuttle bus carrying all those nutrients. Next, heart rate also increase. Why? Think logic again, guys. Pregnant women now have more blood volume as mentioned before. Of course, the heart now has to pump faster to move this blood through. For sure, increase in the blood volume also lead to increase in stroke volume. Means increase in the volume of blood pump per minute. Cardiac output increase throughout pregnancy. For your information, cardiac output increase due to two reasons. First, if in early pregnancy, cardiac output increase because stroke volume increase. But later in pregnancy, cardiac output increase because heart rate increase. Again, these pregnant women have more blood volume. So heart will beat faster to pump faster, cause increase in heart rate. Also, stroke volume increase as volume of blood pump per beat increase. Eventually will cause cardiac output. The volume of blood pump by each ventricle per minute increase. Very easy to correlate, right? And peripheral vascular resistance decrease in early pregnancy due to some hormones. Estrogen and relaxin are the hormones that stimulate nitric oxide production. Remember that nitric oxide involved in vasodilation. Also, progesterone itself has vasodilatory effect. When blood vessel now is dilated, for sure the blood pressure will decrease, but only very little, yeah? Not too much, it will decrease. Venous pressure. Okay, everyone imagine. There is uterus. This uterus will enlarge and for sure it will compress or put some pressure on femoral vein and inferior vena cava. When there is compression, of course, the pressure in the veins increase and cause the blood go out from the veins and cause edema in certain women. Varicose vein can also occur in pregnancy due to pressure of the uterus on inferior vena cava and veins in the leg itself. Just imagine you're lying down, so blood easily go to your heart. But when you stand up, there is compression of veins from uterus. So yeah, your blood now takes time to reach your heart. Blood pressure temporarily drops. As simple as that. What you need to do is just try to correlate one by one starting from the blood volume. It will be easy. So yeah, I think that's all. Thank you for lending me your ears.
Okay,
Okay, that was
10
wonderful.
seconds extra.
Oh, it's okay. We enjoyed, isn't it?
Yes.
So I think is everybody around or who's not around? Hainan Ahmed?
I think he's waiting in the final time of
Nakib.
Ahmed here.
Nakib. Lila Penakib.
Lila Penakib.
Sorry. Okay, I will Akhil, the leader.
Yes, Doctor.
Is that done?
Okay, I'm just checking. Aisha, Arafa, is Arafa's here?
Yes, doctor, I'm here.
No.
Yes, I'm here, doctor.
Yes. Okay, sorry. Yeah. Okay, so. Okay, all right. Thank you so much for the wonderful presentation. So I'll start with the. You want to know the best presentation or the best presenter, or I ask you, or you want to ask?
Already?
Huh?
Already, doctor. You already decide.
No, I'm just asking you. Want me?
You already decide?
Yes, of course.
Oh.
Of course. The time is very valuable. On spot. You have your mark, you have everything now. That's something good about the presentation. Okay, so let's, from my side, from my opinion, the best presentation is for group 3, Matira group. Overall, the presentation, we feel that it's like one person preparing the slides and the flow and how the slides looks like. I like the most the group 3, even though Kai is not there, but it's not affecting the group at all. So overall, I like the group 3. How about you?
Yes, the slide is wonderful. Pretty.
Yeah.
Thank you.
Yeah. Okay. Otto, what do you think? You can disagree. I love to hear from you if you disagree. That's a good thing. If you disagree, I want to hear another opinion.
Yes, I agree because yes, I agree, doctor, because the presentation, I read some of the presentation and it's very short and very understandable.
Okay.
And the explanation is, even though
Anybody
it's
has
quite
another
fast,
opinion?
good.
Yeah. But I'm talking only about how the presentation looks like. Okay, how the way of presentation and the presentation, the PowerPoint, regardless the
Kelas.
presented, okay, so if you got this
Mak nak pergi dah ke? Bye-bye,
somehow
Mak.
it's unique. Okay, all right, who's the best presenter?
Yani or Shaira or
Shaira.
Yani,
Shaira.
Siva.
Okay, you want to know from me? I have already. I'm not affecting by your opinion. For me, also Shahira is the best for today. Okay, Shahira is the best presenter. I would like to see Shahira in the future. Beside whatever she wants to do, I think she has to teach. Okay, if you teach, I come to your class. You have to teach, Shahira. No way. Whatever you want to do, but still you need to teach. Okay, for me, I like your way of teaching. It's very good and and it's very clear. You have unique way to give your. I'm still looking for my writing. Also, I like Hazila's way of presentations. Very good, very clear. Hazila also. Okay. Thank you. The presentation, I like Hazila a lot. Also, I like Aisha. She presents very well using her words. Anis as well. Okay. I like the presentations from, okay, the most improvement, you know who goes to who? Somebody's improved a lot. Really, it's a lot. Who?
Izu? Is it?
Izul?
Huh?
Nakib.
Who improved? Huh?
Nakib.
Nakib, yes. Yes, Nakib. I was like, is that Nakib? Nakib is not here, isn't it? But really, I like his presentation. It was very good, even though he's still need to justify the time. Some of you, I think, maybe more than 7 students, still you need to justify the time. So if you have 2 minutes, you have to practice to present within those 2 or 3 minutes. But Nakib, he presented very well and he improved very well. Even though the sound still a little bit is not so clear, but that's something technical problem. But really, I like how did he present. He improved a lot. Okay. Okay, Ahmed also. Ahmed improved. I think Ahmed's not here, but Aynan, maybe she can share with him. He's next to you. Okay, thank you, Ahmed. Ahmed also improved a lot. He was the first presenter, and I liked his presentation. It was very clear. Okay. Okay, I'm just highlighting some of you. Okay, I cannot go through one by one, but if you want, you can ask me later. Okay, you can text me if you want something special about you. I wrote for everybody. Okay, some of you, I don't want to mention names, but maybe around a lot, maybe also around 7. Your slides, you wrote a lot in the slides, so it's not interesting at all. Okay, so in the future, when you want to prepare presentation, you cannot just write everything in the slide. The slide looks crowded, and it's not clear. And also, you just read the slides, so the people cannot really enjoy your presentation, even though if you have a lot of information and everything, but it's not nice. If you try to make bullet points, or you make flow chart, or you make another way to present, it will be easier to the presenter, and you can catch the presenter, can stay with you. And also, you don't have to write every single thing. You have to write something and mention the reason. Write and mention the reason. So this is, I like to, I think Anis, Aisha, too many of you doing this. It's very good. Nakib also, he wrote something, then he explained. He didn't read every single word, and that's what I like. I like also the Otto's presentation. It's very well. I think in his group, the best is Otto. I like the sequence. How did he present? I mean, he mentioned something, and he mentioned why it happens. I like. It's very. I enjoy his presentation. Okay. Okay, so some of you just write everything and you just read, and that's maybe in the future try to justify. Okay, try to not do that. It's not good to present this way, even though maybe you see other people present this way, but don't follow them. This is not the right way to present. Okay. What else? Okay, for this presentation as the physiology, always you need to mention why. So if something happens, you need to mention maybe a few things you don't know, or you couldn't find the reason why this changes and why this happens, but you have at least majority of your presentation showing why this happens, because presentation or physiology, when you present for physiology, it's all about a mechanism, or at least you mention, okay, this happens because of estrogen, this happens because of progesterone, this happens because we need more blood to the babies, and so on. Okay, something like that. So some of you, majority of your time when you present, you didn't mention why this has happened. So you can compare. Maybe somebody presents respiratory system and your classmate presents also the same system. So maybe you can see the different, how the other person mentioned underlying causes or reason, and it looks like more why we are doing this. One of you compare on it. I like the way you show pregnant and non-pregnant, pregnant versus non-pregnant. That one is very nice. I like it. I like that slide. That one show if somebody doesn't know. If imagine you are presenting for non-medical people. Okay, so it will be more interesting to show the physiological changes in pregnant versus non-pregnant. That slide I like. Some of you show some tables also, like especially in the last presentation has a lot of tables. The way of presenting, it's nice. I like it. I like Aisha's flow chart. She has a lot of flow chart. It's very, very nice. And I think Matira has some drawing also. It's nice. I like it. Matira and Oyun, both of you present placental hormones, but you present only 3. Actually, we have to mention all. So we have 6 hormones or 7 hormones. So at least you have to mention, and you write in your slide the function of the other 3, and you can concentrate on the first 3. So maybe you can say, okay, I'll go through number 1, 2, 3, which is blah blah blah, and 4, 5, 6. It's here in the presentation. So if somebody asks you and wants to know more, it's there in the presentation. Okay. So next time, if you want, you cannot just select and put something in your presentation and other things. It's not there at all. Since you mentioned, you have to put it there. So it's very important to show all hormones and functions of placenta. It's nice. Okay. Of course, this topic you will understand more. Maybe I think during year 3 you'll start with Dr. Khalid, Dr. Khalid, and Dr. Hamida. You will understand more about pregnancy and all of those things. But you have, I can see your information is very good and high level. You have to be proud of yourself, all of you. You have to be proud of yourself. You have to be happy the way that you find the information and gather the information and put them systematic. So all of you did very well. So, but still, I need to mention if somebody's slide is still not that good, maybe you need to improve next time, isn't it? Yes. So that doesn't mean your presentation is not good. Maybe for other people it's perfect, but for me, I don't like the crowded slides. For me, that's my opinion. I don't like crowded. Maybe somebody else that's perfect. So, but overall, I think it's more attractive if you use flow charts and minimize what you have in your slides. Okay, that's much better. What else? Okay, I have a lot of writing today. Okay, spelling. Some of you has spelling mistake. You have to check your slides, okay? So that one of the negative things is spelling. Spelling important. Somebody write about the sheep and has some words instead of O, you wrote A. So you have to check your slides. And also, even though you combine from 5 of you, so still you have to go through from first to last slide, and you have to avoid repeating the same information. I think one of you has, I don't want to mention, but one of you, it's okay, but one of you has repeated, 2 students has repeated the same thing, the same part of the information. So you have to make sequence, don't repeat, okay, in the future, okay? But overall, I'm so glad, I'm so happy that I can see your improvement. Okay. I think two of you presenting a little bit fast, 2 or 3. Looks like running. Like Layani. I feel like I can't breathe. Layani, Akil also. Akil, last year also you have the same thing. Akil, last year also you are super duper fast. This time you are just fast. But Layani is still fast. That's just my opinion, huh? Just what I can see. I want to share with you. Okay? Hmm. Okay. Okay, I think that's all from me. Anybody has questions for the other groups? Anybody has question? I like Akil's necktie today. He's really coming to present. I like it. You will got extra mark for that.
Which Akil, Doctor?
Akil Mizra. Akil Mizra?
Show us.
He's wearing necktie. You didn't spot that.
I was watching
Akil
the
Mizra,
slide.
are you still there? Your necktie still there?
No.
Yeah. Yeah, that's more. No, you remove it.
Yes.
Okay, I'll keep the mark, the extra mark. No, you still have the mark. But of course, when you present, you have to at least you wear smart casual. Okay, at least. But better to be more professional as you can. You don't have to buy something new or expensive or whatever. Just how you look like. That's it. Okay. Okay. Any question? Any comment?
No.
No question. Any comment?
All good.
No, Doctor.
Okay, you want to share your opinions or anything with other groups to support each other to improve? Anybody want to say, I enjoy your presentation, I like?
Can I say
You can
something?
say, yes,
Since this is online presentation, so some of us like having internet problem, connection problem. So maybe for myself, is sometimes the voice for my friends actually sometimes like lagging. It's not very clear. So that's why I very focus on the screen actually. But overall, it's because it's keep repeating same. So I understand.
Yes, yeah. Some things, technical things, like due to internet, we have nothing to do, and we just will take it as it is. So we have nothing to do. Okay, would you like to say something good for your friend, like you present very well, you improve, or something nice?
I really like Ahmad.
Yes, and Ahmed, yes.
Yes,
Yeah.
because he was right.
Say thank you for on it.
No, you did it yourself.
Yeah. Yeah, yes. Thank you, Onet, for supporting Ahmed. So Ahmed will do his best forever, inshallah. Okay, anybody else want to say something nice?
But I want to say something back.
Okay, can you make it like a sandwich? Good, bad, good?
What?
You can say the bad, but start with something good.
No, it's not like that bad. It's just I think like because we have to cover like all system and each person get 3 minutes, right?
Yes.
So it's like
okay.
We cannot like justify the detail each point.
Okay.
So,
That's bad of me.
That's why I get water. That's why I do the rap.
Yes.
So I just think that every group point present the same thing.
Actually, yes. Okay. Maybe in another with another lecture, you have your time and you present even half an hour, 1 hour, no problem. But I want you to try something different, because in the future, if you have like conference or you have to present something, always you have a time. So that's why I want you to practice the time. Time is important. 3 minutes is it's too long to present your part. Okay, so you have to take it. No way. Every year I do the same for students, for my students. You are not the first group, but I want you to respect the time and train yourself many times to justify with this time. That's a challenge for you. Okay, Hazila.
Doctor, I have something good for
Okay, so
Hazila.
I'm doing it on purpose. I'm doing it on purpose. I know, but I want you to justify with this time. If you present to your friends or for yourself, so you have to justify. Even some of you may be going to English test assessment. Sometimes you have to speak about something in 45 seconds, or you do something in 1 minute or 2 minutes. So this is the life. Okay, we have two things. We have to, sometimes you have all the time to speak whatever you want. Sometimes you don't have. Okay, on it.
Oh, even I have something
you want
good.
to say something?
Yes, about Hazila. Because even with time restraint, sorry, because even with time restraint, she tried to bring model the straw. I saw it, so it was good.
No, on it. It's not a straw on it. It's an
It's not straw.
Oh, Apple pencil.
I thought it was a straw.
Effort, doctor.
Yes,
Effort.
I saw the effort lah.
So, okay. Siva, who do you like? Do you want to say something nice for anybody?
I think I like Ainan and Rawan one. It's like, yeah, within the time, and I think
they present.
yeah, because
the slides or the information.
The information, because even though it's like they don't start first, it's not nervous and it's in the flow, so it's like a very good start for me to prepare.
Yeah. Okay.
Welcome.
Thank you for Siva. Rawan, would you like to say something? A good thing, okay?
What, doctor?
Matira.
I like Aisha's slide, doctor. So,
okay, yes, I like it too.
Semantic, doctor.
Okay, Aisha, say thank you for Matira. We just spread some love during our last class today. Okay, Arafa, Aizul.
Yes, doctor.
You want to share something nice? I'm sure everybody has something. Maybe even you can say, "Oh, I like your scarf." You can say that. You like your smile.
I love everyone.
It's not everything
I love my
academic. Okay, thank you. I'm sure they love you too.
Doctor, I also want to say something nice.
Yeah, thank you. Please, Hazila.
I think all people give their effort, like the boys group. Usually the boys usually the boys likes to do everything last minute, right? But I think they prepared well this time.
Yeah.
And also I like Onet Tudung style, you know. She looks like a rich woman.
Yes.
Okay,
that's
and Otto looks cute today.
Looks cute. Yeah, I like his big board. The striped one, black and white. I feel jealous now. I want to buy one. Yeah, it's a very nice room. Yeah. And thank you, Shahira, for trying today, trying your best and give solution. That's good. That's nice. Anybody wants to say something for Akil Masra?
Yes, doctor.
Anybody wants to say something to Akil Masra?
Mirza, doctor, not Mizra.
Nice thing or bad thing, doctor?
No, we need nice. There is no bad about him. I'm sure about that. What do you want to say for him?
Thank you for being our class leader.
Yes, you.
Yes.
Thank you for arranging the time.
True.
Yeah.
We appreciate you, Akil.
Yeah. He's doing extra job. He arranged the class and attendance, and he's doing very well, and he's very polite. He's very, very polite. And he's hard worker student. Academic also, he's very good. One of the top students in the class. Akil. Okay, anybody else wants to say something to Akil?
No, macam
Shakir, doctor.
Same, our leader.
Oh, okay.
Okay, Aizul, are you still there? What do you like about today's presentation?
I think I like how Shahira presents.
Presentation. Okay, Shahira, say thank you for Aizul.
Thank you, Izul.
Okay, Akil, Azrai, any comment? We need the good one, huh?
For me, I like the present who explain clearly. And
Okay, some students do. Okay, Nakib, yes, yeah. Unfortunately,
And
he's not with
also,
us
I have to
now.
correct myself because I read too long.
Yeah, so this is next time. Okay, no problem. All of us, we still learning. Me too, I'm still learning. I'm so happy when somebody tell me opinion. So you can take it or you don't take it. It's up to you, this one, okay? So always remember, we are still learning, always, forever. Okay, always we improve ourselves. So that's no problem, okay? Okay, thank you, Akil. Which shampoo you are using for your hair? Akil Azrai. Head and shoulder. Okay. You vote for him.
No, because I saw it.
Oh, all right.
Because
okay,
we were
okay. So we have. Oh, okay. So we have to change to Head and Shoulder. Okay, so we can stop here today. Thank you, all of you. Thank you for your presentation and thank you for your hard work.
Doctor?
Okay. So yes. Yeah.
Last thing,
Thank you, doctor.
Okay, so we can stop now. All right. So I see you next week.
Thank you, doctor.
No way, still I'm with you. All right. Okay, enjoy your day. Bye.
Thank you,
Thank you, doctor.
Assalamualaikum.
Thank you, doctor.
Thank you, doctor.
Stay safe.